Welcome to Ask Dr. Tom. We connect with Dr. Tom to talk about all things health and wellness, cancer treatment, etc. This is Ask Dr. Tom with Dr. Thomas Incledon. He's the founder and CEO of Caucasian Wellness and the Caucasian Cancer Treatment Center in Scottsdale, Arizona. From working with NFL, MLB, MMA, world-class athletes, and even the White House, Dr. Tom's reputation of personalized medicine and cutting-edge technologies have put him on the map for caring for some of the most powerful people in the world, making him one of the most sought-after healthcare professionals of our time. We're talking with Dr. Tom. Dr. Thomas Incledon is the founder and CEO of the Caucasian Cancer Treatment Center in Scottsdale, Arizona, where their mission is to kill cancer once and for all with minimal side effects. And we're talking about triple-negative breast cancer. A lot of people may be most familiar with it because in the news, Angelina Jolie was found that she had this BRCA1 gene mutation, and as a preemptive measure, she got a double mastectomy. As we're talking with Dr. Tom, and we're learning more and more about what you could and couldn't do, or should or shouldn't do, or might want to consider, we're learning about that gene mutation and what you can choose to do as other options. One of the things that they do at Caucasian Wellness is they institute and implement alternative therapies. Are there other treatment alternatives for triple-negative breast cancer patients that perhaps you implement at Caucasian that would work for women that are diagnosed?
Yeah, there sure are. I mean, so first, what I would say is that when we do a workup of a case, we look at other things going on in that person's body. So, for example, do they have coagulation issues, meaning their blood has got a high potential for clotting? Do you have inflammatory markers like homocysteine, a lipoprotein A, or some other things like an erythrocyte sedimentation rate or CRP markers that are elevated? We try to address those markers through exercise and nutrition, and then we follow up and test those markers so we could verify they are improving for that patient. And if they don't improve, then we try something different. It's that straightforward. So one way or another, we're going to find something for that individual that will help them. Now, in terms of cancer fighting, part of that, it depends on the uniqueness of that situation for that individual. But as an example, we could look at tools. For example, if a woman has trouble managing her glucose levels, and they're running high, and exercise alone and diet changes are controlling that glucose, then we can look at tools like metformin. If someone wants, let's say, an inexpensive drug option. If someone says, look, I don't want to use medication for whatever reason, we can look at natural strategies like alpha-lipoic acid with berberine and hydroxycitric acid, or even Gymnema sylvestre. Those are other options to control glucose levels in the blood. If someone says, "Hey, I'm not comfortable with doing a fully chemotherapeutic regimen," we can look at ways of creating some alternative medical options for them that we can test for them. And if they see their tumors are shrinking or their cancer activity is going down, then they know to stick with it. And if it doesn't work, then they know, hey, I better try a more aggressive regimen involving some chemotherapeutic agents, because from our perspective, the end of the day, we want results for our patients. And so, we're going to have lots of tools that we could look at and explore with each individual.
We're talking with Dr. Tom. This is the Ask Dr. Tom show, and this particular form of cancer is something that young women should be aware of. I think, especially as Dr. Tom sharing with us, the higher risk among Latina women and African American women for this BRCA1 gene mutation. So based on what we're learning from you, Dr. Tom, and what you know about triple-negative breast cancer in young women, if you're a young woman that has tested positive for the BRCA1 gene mutation, what are her options for preventing the development of triple-negative breast cancer?
So, well, first, let's look at some risks that are present. So some of the risks are age. So it tends to be more likely in women less than 40. Second is African American and Latina descent. And then the third one would be presence of the BRCA1 gene. So those things are typically things you can't control, right, for reducing your risk. So now if we look at other things we can control, one is obesity. So excess body fat appears to contribute to inflammatory load on the body. And what you don't hear a lot of times is as the United States as a country, our obesity rates are going almost vertical. Many states now have way more than 1/3 of the people in the state are clinically obese, which means they have greater than 30% body fat. Years ago, we would think of body fat as kind of like, oh, I got extra weight and I just got to work harder to walk. And then we started finding that the fat cells, as they get bigger, they produce more inflammatory molecules that could damage us. So body fat is a significant threat to our health once it gets too high. So that means, we can control, if we can control body fat through movement and careful planning of our eating, that's going to be a huge stride. What you don't hear so much sometimes is that alcohol intake has some unique patterns or relationships to cancer. Red wine with the meal seems to be okay, but any alcohol, including red wine, just drinking it, let's say on an empty stomach or without food involved, it appears to increase risk for cancers overall. And whether that's because of DNA damage or some other reason, it's unclear. But one of the interesting things alcohol does is it throws off glucose metabolism, it throws off fat metabolism. So the body appears to burn the alcohol more readily than sugar and fat. So now the sugar and fat store in different places around the body. So, and then we know that there are lots of phytonutrients that nature provides that reduces our risk for cancer. So comes back to, eating colorful fruits and vegetables again. And if I had to throw in some things that maybe aren't so clear, from research, but I would say just kind of makes sense to me based on studying people at our center. Sleep is a big factor that I think many people underappreciate a good night's rest. They just wake up saying, I'm tired, but they're not thinking about all the inflammation trapped in their tissue that they can't see, touch, or feel. And then staying properly hydrated. We know that there appears to be more inflammation for people that are dehydrated. So you got, as a quick, short checklist, sleep right, or get enough sleep so you wake up feeling ready to tackle the world, eating enough fruits and vegetables so that you're making sure you feel real good, making sure you're moving every day, at least 30 minutes or longer, and then making sure you're doing things to control alcohol intake and minimize body fat gain. So, where I look at body fat is if you're getting fatter, just move more. It's that simple. So I'm asked all the time by patients, what's the difference between personalized medicine and traditional medicine? And in traditional medicine, there's a singular approach. So you have cancer A, and for cancer A, here is the standard of care treatment. And after you go through the standard of care treatment and it doesn't work, typically there's not a plan B. There's not another option. So then patients are told, hey, there's nothing else that can be done. And so then they're convinced that, hey, there's no hope and we can't do anything else. Now I want to contrast that in a personalized approach that we have at Caucasian. We're going to measure all kinds of details within your body. And we're going to find lots of areas that we can actually improve your health. And then indirectly, by improving those areas, we're going to help you do a better job at fighting cancer. So whereas someone else would say, hey, there's nothing that could be done, we're going to say, hey, there's lots of opportunity here to improve your health and make sure that you have a better quality of life so that you're able to function and live life under your own terms and not just waste away in a bed in hospice somewhere and watch everything go by you as time passes on. So if you or a loved one has been diagnosed with cancer and you're looking to get help, I strongly encourage you to go to causenta.com and fill out the form at the bottom of the page and find out for yourself how we can help you.